Hi, I'm Dr. Jay Varma, and I'm breaking down for you whether or not you should be worried about the flu season in 2025. Now, there are a few reasons we need to be worried about flu in 2025, and why I'm predicting it's important to take some precautions this coming winter virus season. First, there is a new strain of flu that is circulating. There have been some mutations that have developed in the H3N2 strain earlier this year, and it's already causing surges in the flu in Japan, the UK, and other countries where they're seeing lots of people hospitalized and some people dying. We also know that here in the United States that fewer people are getting their flu vaccine and fewer people are taking the precautions that kept a lot of people flu free during the COVID pandemic. So, what are some of the most important reasons you should think about taking precautions? Well, the first is that hospitals and clinics are likely to be overwhelmed. Anytime there is a bad flu season, people come to the emergency department, they go to clinics, they go to hospitals. And so, if you're expecting that you can get seen when you get sick, that may not be the case. And it's not just flu that overwhelms hospitals. We know that lots of people are not getting COVID vaccines. So we're likely to see a surge in COVID infections at these healthcare facilities as well. And the final reason is one that a lot of people don't really think about, which is that flu and COVID don't just cause a cough and a cold. They can also increase your risk of heart attacks. They can increase the risk of strokes. And if you have diabetes, they can severely worsen your glucose control. Now, what are the ways you can boost your immune system? What I always tell people to do is boost your immune system the natural way. And I actually mean vaccines. And what do I mean by that? I mean that seasonal flu vaccines use your natural immune system to protect you. And because of these mutations in the flu strain, we can only expect partial protection. Well, what does partial protection mean and why would you want it? Well, what partial protection means is that it would reduce the severity of illness if you get the flu, and it can reduce the likelihood of you going to an emergency department and a hospital. And the reason we know that is because of new data that's just come out from the UK with this new flu strain showing the way in which the flu vaccine can provide that form of partial protection. Second of all, there are some other natural ways that you can use to boost your immune system. And these are particularly important during the holiday party season. First, get more sleep. Second, drink less alcohol. And third, try to exercise more. And we know people always try to do this in January at the beginning of the new year, but with the flu season potentially kicking off sooner, it's important to get in touch with those habits right now so you can strengthen your immune system as much as possible. And it is important to remember that there are precautions that work. Now, of course, everybody has hangover from the peak of the COVID pandemic, but we can't disregard their effectiveness. First of all, we know that KN95 and N95 masks can help keep you safe. They can protect you from getting infected and from giving infection to other people, especially important if you're traveling by plane during this winter season. Second of all, having a test kit that can test for COVID and flu can help you, especially if you have vulnerable family members, people who are particularly likely to get severely ill if they get flu or COVID. And finally, consider having a stockpile of the medication Tamiflu on hand or getting in touch with a primary care doctor or an urgent care facility as soon as you get sick. This is especially true with kids and in pregnant women. And it's important to keep in mind that this medication will only work if you get it within 48 hours of your symptoms starting. I'm Dr. Jay Varma, bringing you helpful news about how to keep yourself healthy during this coming winter season.